होता है. Yes, he is joining. So देवके sir join झाला, we will start.
You're ready to start, ma'am.
Yeah, thank you, Piyush. So good afternoon, all. On behalf of IMA Nagpur, I, Dr. Prajakta Kaduskar, Joint Secretary, welcome you all for the CME on this 7th April World Health Day. The theme of this year being Our Planet, Our Health. And we have got eminent speaker, Dr. Sanjay Deshpande, and chairpersons with us. I welcome you all, and I request Dr. Prakash Dev, President IMA Nagpur, to give the welcome address. Dev sir, over to you.
Am I audible?
Yes, sir.
Yeah. Good afternoon, everybody. We are here to discuss about this year's World Health Day and importance of the theme on World Health Day. Friends, every year WHO comes out with a theme of public health importance based on scientific, social, and operations research. The purpose is to create awareness and sensitize all concerned stakeholders, be it politicians, community gatekeepers, administrators, NGOs, civil society organizations, including sensitization at individual level. And further to take forward this agenda seriously to attain the definition of health. Unfortunately, each one look towards health in achieving health in silos and do not think a real coordinated efforts. I personally feel, and you will all agree with me, that health has to be looked into a broader perspective. It is because positive health outcomes impinges on many non-health issues beyond control of public health department or health sector only. Unless all sectors other than health could be like education, women and child development department, public works department, irrigation, forest, energy department, finance, they all sit across the table, discuss health and work in tandem. To me, it is just impossible to achieve health goals. More so, planning and execution by all these departments need to be considered favorable or adverse implications of their plans on health outcome. This year's the theme, Our Planet, Our Health, is to me just not a fancy slogan. Embedded in it is a serious thought-provoking process as to how planet change, environment change adversely affect health, and also unhealthy habits and behavior do adversely affect our planet. And it is high time for us at individual and at organizational level to keep our planet healthy, promote healthy habits, and at the same time continue dialogue with key stakeholders at each level to create pressure to look towards health in a broader perspective. This requires short and long-term planning, appropriate budgetary allocations, review and amendments to existing acts and rules within and with a strict component of vigilance and monitoring by all. And to me, a tagline, we would be healthy if we keep our planet healthy. We have today experts with us who would be dwelling upon important issues and concerns. I hope you would be getting sensitized, but this sensitization may last for a year, for 1 hour or 2 hours. But I'll appeal you that let this sensitization continue, and this sensitization leads to some doable and feasible activities, strategic interventions at individual level or at organization level, including sustained advocacy efforts. Friends, we every year observe World Health Day, and my expectations would be when we observe next year's World Health Day, the first session should be, while observing next year's World Health Day, we may have a first session on what we were able to do in context with the theme of this year. What we do, in what capacity we were successful, what were the failures, that could give us lot of learning opportunities to move forward. So I stop at this stage. Wish you all the best, and I hand over to the coordinator. Thank you very much.
Thank you, sir. Thank you for words of wisdom. Now I welcome our chairperson, distinguished chairpersons, Dr. Sushma Thakre and Dr. Anirudh Devke. Dr. Sushma Thakre is Associate Professor, Community Medicine, IGGMC, Nagpur. She is presently IMA AMS Chairperson, Vice President. She was Vice President, Maharashtra IAPSM. She had published more than 50 scientific papers in various national and international journals. She was principal investigator for 2 clinical trials and co-investigator for 2 clinical trials. She has been awarded with prestigious Dr. Ramadwar Oration in State IPSM conference. Dr. Aniruddha Devke is Professor Community Medicine, NKP Sarve Institute of Medical Sciences. He has got 17 international and national publications to his credit. He is member Board of Studies MUHS, member Students Welfare Board MUHS, and currently Treasurer IMA Nagpur. So welcome you, Madam and Sir. Over to you, Madam.
Thank you, Prajakta. And good evening to all. First of all, I want to congratulate Dr. Prakash Dev sir, the new president of IMA Nagpur 2023, Honorary Secretary Dr. Samir Jagirdar, and all the office bearer of 22-23. So this is the first CME of our tenure. And as we all know that World Health Day is celebrated on 7th April of every year to make anniversary of the founding of WHO in 1948. Each year, a theme is selected to highlight an area of public health concern in the world. Since 1950, World Health Day has been celebrated every year on the 7th April with a different theme. The theme for World Health Day 2022 is Our Planet, Our Health. So this year's theme aims to direct the global attention towards the well-being of our planet and the human being living in it. जागतिक आरोग्य दिन. आजचा जागतिक आरोग्य दिवस म्हणून साजरा होतो. अनेक ठिकाणी आरोग्य व निसर्ग समतोल यावर चर्चासत्र देखील आयोजित करण्यात येतात. पण खरंच कोणतं आरोग्य महत्वाचं असतं? शारीरिक की मानसिक का भावनिक आरोग्य? मला वाटतं निसर्गासोबत या 3 प्रकारच्या आरोग्याचा समतोलही अत्यावश्यक असतो. त्यानेच माणूस सर्वार्थाने सुदृढ होतो. कारण शरीर तेव्हाच औषधोपचार साथ देतं जेव्हा मन सकारात्मक भाव जपतं, जेव्हा भावना वेग काबूत ठेवता येतात. निसर्ग तर महत्वाचा घटक आहेच आरोग्यात, कारण जेथे निसर्गाचा समतोल ढासळला तेथे माणूस आरोग्याला समजावे मुकला. तर या ज्या सुंदर लाईनी आहेत त्या IMAMSच्या ऑनररी सेक्रेटरी डॉक्टर रागिणी मंडलिक यांनी लिहिलेल्या आहेत. मी फक्त तुम्हाला वाचून दाखवते. Now I would like to invite today's speaker, Dr. Sanjay Deshpande. As such, he don't need any introduction, but by profession he is practicing sexual medicine. He is chairperson of CSEPI. He is honorary secretary of Indian Andropause Society. He is finance director of IMA-MS PPS. He was past president of Indian Medical Association Nagpur. He was recipient of Golden Lamp Award CSEPI. He was best honorary secretary of IMA at state and national level. He was best president of IMA at state and national level. And he is recipient of Dr. Suresh Nadkarni Mitra Mandal Award for articles on sexual medicine by IMA Maharashtra. So with this brief introduction, I invite my friend Dr. Sanjay Deshpande, and he is going to speak on today's World Health Day theme, Our Planet, Our Health. Sanjay, over.
Thank you. Thank you, Dr. Sushma, for a very nice introduction. Prajakta, can I share the screen now?
sir, I have stopped sharing.
Okay, thank you. One minute, I will stop it and I will do it again because it is in a smaller window. Yeah. I hope everybody is able to see the screen.
Yes, sir. Yes, sir.
Prajakta, are you able to see the screen?
I am not able to see.
No, no, Sanjay, no.
No, sir, we can't see your screen.
Okay, I will share the screen now.
Yes, it is visible, sir, but just make it slideshow mode.
Yes, yes. Why it is not getting slideshow, I don't know. Piyush, can you help us?
Sir, here we have
Yes,
got
sir.
slideshow on the taskbar. You can click it
Okay.
and yes, and then from current slide or beginning, from beginning. Again.
Again here.
Again,
Yes,
click slideshow.
yes,
Yeah,
from beginning.
From beginning. Okay.
Yes, we are able to see.
Now I think you are able to see the screen.
Yes, sir.
Thank you. Things rightly. Yeah. So thank you, Chairperson Dr. Sushma Thakare. Thanks to IMA Nagpur, especially the President and Secretary of IMA Nagpur, Dr. Prakash Dev, and Dr. Samir Jahagirdar, for giving me an opportunity to share this important topic with all of you. Friends, today only when just I wake up and I just saw my WhatsApp, some of my friends wrote on WhatsApp that Happy World Health Day. So now it has been a fashion or a custom nowadays that to wish Happy World Health Day or happy other days also. But let me tell you, as rightly told by Dr. Prakash Dev, President of IMA Nagpur, that this is not a day to celebrate. In fact, World Health Day is to be taken very seriously. WHO always every year gives a theme so that every country, every state, or every society and individual should work on that theme. It's not that we have to work only for 1 year, because this year's theme is so big theme, our planet and our health. This is the theme of this year, and this theme is very, very important for us because climate changes and all other things which are considered in this theme are not so easy to be carried out in 1 year. We may require our life also to do all these necessary changes so that we can ensure that the healthcare delivery system as well as the health of the society and individual or the nation as a whole will be perfectly all right. And that's why this theme is chosen. And I will deliberate on this, though this is a very vast topic. I will try to finish it in my stipulated time of 30 minutes. So kindly bear with me if I am fast during some slides. So this year's theme is Our Planet, Our Health. And most important aspect of this theme is that we should strive very hard for clean our air, water and food. Anna, Vastra, Nivara, Roti, Kapda or Makan. These are the three basic amenities or basic requisites for the life of any individual. And again, in so much advanced era, we are coming to the same basics. Now, why? Because the pollution, the various other effects of climate, the global warming and everything is pushing us to think again and going back again for these most important and necessary things in the life of any individual, not only human beings, but for all other animals and plant kingdom and everybody. So clean water, clean air and clean food. These are the most important aspect of our life. And unfortunately, we have to again and again work on these three basic aspects. Before going further, we have to ask ourselves these three basic questions. Are we able to reimagine the world where clean air, water and food are available to all? We sitting in our highly affluent people, being doctors, we are socioeconomically very high compared to other persons in the society. But is clean air, water and food is available to everybody in the society? The answer everybody knows. Where economies are focused on health and well-being, we always in our economy, this IMA also is always shouting at the governments, maybe state government or national governments, that very minuscule of the GDP is spent on health and infrastructures, 1.5 to 2.5%. Even the developed countries or smaller countries like Sri Lanka and Thailand, they spend more amount than what India spent on the health infrastructure. And percentage wise, it must be very high. So really, only the money will give the health and well-being to the population. This is $1 million question everybody of us must ask. One another question I always ask, that can only doctors are responsible for health of the society? Are there any other department, any other profession responsible for it? And we'll see in the latter course of our lecture also that there are many departments, many professionals who can help improve the health of the society and nation. Can we work on cities where the cities are livable and people have control over their health and the health of the planet? So these are the three basic questions we should ask ourselves, and WHO wants to work on these three basic issues. Now we have, from last 2 years, we have been in a very serious situation, the COVID-19 pandemic. With this COVID-19 pandemic, we saw that we are a polluted planet. We don't know about other planets, but because there is no human population on other planet, maybe they are not polluted. Because only species in the world which pollutes the atmosphere is human beings. The animals, other species, plants, they don't in fact pollute the planet. In fact, they try to save the planet. Now, increasing the diseases like cancer, asthma, heart diseases, all non-communicable diseases, they are on high rise. It is already, it's called as modern pandemic, modern epidemic. They are always on rise. So even if we have pandemic, we have not got rid of any of these modern epidemics. So on World Health Day, WHO wants to focus our attention on urgent actions needed to keep the humans and the planet healthy. For a movement to create societies focused on well-being. It's not only disease-free, but well-being society is more important. Now, it has been already estimated that around 13 million deaths, they are occurring around the world each year, which were avoidable because they are caused by the environmental factors. These includes the climate crisis, which is the single biggest health threat to the society. The climate crisis is a health crisis. Everybody of us must understand. Otherwise, we can feel that what we have to do with climate. Just think of today. What heat and what exhaustion, heat strokes, sunstrokes, which we were observing in latter part of April or May. We are seeing all the effects in the last dangerous situation nowadays. And we have to think about it and act on it. Our political, social, and commercial decisions are driving the climate and health crisis. Over 90% of the people breathe unhealthy air resulting from burning of fossil fuels or petrol and diesel and all petrochemical substances. The heating world is seeing mosquito spread and diseases further and faster than ever before. It is speculated or estimated or guessed that in current years we'll have again all the malaria, all the mosquito-borne diseases like dengue, more life-threatening diseases will be more in nature. So it is very urgent for us to act on this. Extreme weather events, land degradation, and water scarcity are displacing people and affecting their health. People are moving from one place to another, thereby creating health hazards on themselves. Pollution and plastics are found at the bottom of the oceans and highest mountains also. And even they have made their ways into our food chain also. So plastic is also most important biological hazard now we are facing. Systems that produce highly processed, unhealthy foods and beverages are driving a wave of obesity, increasing cancer and heart diseases, while generating a third of global greenhouse gas emissions. While the COVID-19 pandemic showed us the healing power of science, it also highlighted the inequalities in the world. We know that most of the world, most of the developing countries, we also can be included in that. We were striving hard for the admissions of the patients, for oxygen demand, for various drugs, for the scarcity of manpower, trained manpower, not only for doctors, but for all other paramedical workers. So the $1 million question today is, are we ready to face the challenges which we may face in future due to all the health effects of this climate change? The pandemic has revealed weaknesses in all areas of society, and the underlying urgency of creating sustainable well-being society is committed to achieving equitable health now and for future generation without breaching ecological limits. The present design of the economy leads to inequitable distribution of income, wealth, and power, with too many people still living in poverty and instability. A well-being economy has human well-being, equity, and ecological sustainability in its goal. As rightly pointed during his introductory remark from Dr. Prakash Dev, President of IMA Nagpur, as most of us or most of you will remember that when we say that primary health care is important, primary health care is based on 4 principles. And the most important principles are community participation. Any health care cannot be successful without participation of the community, the member of the communities. As well as there should be equitable distribution of the health resources, which we have found that it is not. Resources are less in developing countries, resources are less in rural areas, resources are less for poor people. So there is constant inequity in the society. And these goals are translated into long-term investments, well-being budgets, social protections, and legal and fiscal strategies. But as just I narrated earlier, we are not giving too much importance to climate change as well as preparing our healthcare delivery system to cope up with this. And that's why this cycle of destruction for the planet and human health requires legislative actions. It's not only in the hands of you and me but our parliament, our assembly, our corporation, they all should think about it and find the reforms so that individuals also can be involved in this. Now, these are some figures which we must know, I think, that air pollution kills 30 people every minute due to lung cancer, heart diseases, and strokes. So if we stop burning fossil fuels like oil, coal, and natural gas, we can try to avoid these much deaths. Stop burning fossil fuel like oil, coal, and natural gas. 9 out of 10 people breathe polluted air. Stop burning fossil fuels. Petrochemical, we have to find the alternative ways. As everybody of you must be remembering that one of our minister from Nagpur, Shri Nitinji Gadkari, he is always asking us to have the various other non-conventional sources of for alternative to these fuels. We should try to use this. 9 out of 10 people breathe polluted air. Burning fossil fuels like oil, coal, and natural gas causes air pollution. So keep these fossil fuels in the ground for a healthy planet and healthy me. Climate change is a threat to human health, driving diseases like cancer, asthma, heart diseases, and mosquito-borne diseases like dengue. Because previously we thought because of this climate change, only non-communicable diseases will increase, but it's not like that. Even zoonotic diseases and many other diseases will be on rise. 3.6 million people around the world don't have safe toilets. Though we have started, central government and state government has started these schemes right to the grassroots, but still most of the people, and 3.6, I can definitely without statistics can say that half of these figures must be from our country or from the Asian countries. And this untreated human waste degrades ecosystem and human health. So all waterborne diseases and all other things, they are on the rise. 2 billion people don't have access to safe drinking water. And we are thinking that we are developed. So it is very, very harsh realities that we have to be prepared for, and we have to wake up early now. Untreated human waste is making us sick and degrading our ecosystem. 8,29,000 people die from diarrheal disease every year caused by polluted water and poor sanitation. Figures are very high. And unfortunately, deaths are from those communities which are not contributing to these climate changes. All the poor people, not using petrochemicals, not doing anything. Manage medical waste safely. Needle stick injuries from discarded syringes can cause hepatitis B, C, and infectious diseases. Emissions from burning of the healthcare also can increase the cancers. We have to reduce these emissions, reduce this medical waste also. That is primary our responsibility being the healthcare providers. Tobacco kills more than 8 million people every year and is highly addictive. It's major risk factor for cancer, heart and lung diseases. 600 million trees are chopped down to make 6 trillion cigarettes every year, thereby decreasing the clean air we breathe. So it's double-edged sword. Rising temperatures and floods caused by climate change will place an additional 2 billion people at risk of dengue. Huge will be the burden on the healthcare system also. People will be definitely at risk, but our health system also will be crumpled. Nitrogen dioxide or pollution from traffic, power plants, industry, or agriculture can aggravate respiratory diseases, particularly asthma. So well-planned public transport systems along with safe walking and cycling can improve health quality, air quality, climate change, and improve physical activity also. So it's time for us to take action for our planet and our health. So in short, I will tell that this climate change affects the social and environmental determinants of health, because it is hampering clean air, water, sufficient food, secure shelter. Housing also is affected because of this. And if you see the additional burden on the health system, the mortality and all, it's very huge. Between 2030 to 2050, climate change is expected to cause approximately 250,000 additional deaths per year from malnutrition, malaria, diarrhea, and heat stress. Because this global warming will increase the heat like anything. So heat stress also will be one of the most important factors. The direct damage cost to health will be estimated to be around $2 to 4 billion per year. So it's a huge burden on the economy also. Areas with weak health infrastructure, and that too mostly in the developing countries, will be the least able to cope up with these problems. So they have to be prepared and respond to the need. Reducing emission of greenhouse gases through better transport, food, energy, huge choices can result in improved health, particularly through reduced air pollution. Climate change, the biggest health threat. Climate change is the single biggest health threat facing humanity. And health professionals worldwide are already responding to the health harms caused by this unfolding crisis. So government is advising that this world must limit the temperature rise to only 1.5 degrees centigrade, not more than that. The global heat of even 1.5% is also not considered safe. And every additional tenth of a degree, 0.1 degree centigrade increase also will have a serious toll on the people's life and health. While no one is safe from this risk, the people whose health is being harmed first and worse by the climate crisis are the people who contribute least to the causes. I said poor people who are least able to protect themselves and their families. People in low income group, disadvantaged countries and communities. And India also is a developing country. The climate crisis threatens to undo the past 50 years of progress in the development, global health and poverty reduction. And because of that, again, we are going into the vicious circle of climate change and poverty, and that will go on. And this is universal, this is severely affecting the realization of universal health coverage. You must be, I think, around 2 to 3 years back only, this was the theme of World Health Organization on one particular World Health Day. I think it was in 2017 or 18, if I'm not wrong. So that is severely getting affected. Over 930 million people, around 12% of the world's population, spend at least 10% of their household budget to pay for health. And 100 million people every year are going into poverty because of their expenditure on health and health care. Because government is not able to provide them the facilities. We have seen in this pandemic, though government strived very hard to provide all the things to the population, but still people had to spend a lot of money from their own pockets. So how climate change is responsible? Now there are vulnerability factors, exposure pathways, and health system capacity and resilience. So what are the vulnerability factors? Demographic factors. Whether your population is living in rural areas or urban areas, various demographic changes taking place. People are moving from rural areas to urban areas, rapid industrialization, modernization. There were more and more people living in cities with having less sanitation, not having good proper hygiene, not good housing. So these demographic factors, they are also adding to climate change. Geographic factors like very humid and hot atmosphere, two extremes, very hot and very cold atmosphere, that may also can contribute on the health due to these climatic changes. Biological factors, health status, the already ill people will have more problems. Socioeconomic factors, poor people will have more problems. Exposure pathways, extreme weather conditions, heat stress, bad air quality, bad water quality, food security and safety, vector distribution, mosquito breeding, Everything will contribute because of these climate changes. Health system and capacity and resilience. Are we able for this battle, being a leader, is government is working in harmony with the healthcare system, whether we are having sufficient health workforce, our health information system, is it proper? Can we take the early warning signs of this climate change and act accordingly? Various medical products and technologies, service delivery and financing. And all these problems can be there, which are enlisted here, right from the injury and mortality from extreme weather conditions, to heat stress, to respiratory illnesses, waterborne illnesses, zoonosis, everything. So we know that climate change is already impacting here. Disruption of food systems, increasing zoonosis, food, water, and vector-borne diseases, all they are happening. In short, to medium term, the health impacts to the climate change will be determined mainly by the vulnerability of the population, their resilience to the current rate of climate change, and the extent and the pace of adoption. How fast we adapt to these various factors which may lead to various health hazards. We have to act very fast. So pace of adoption also should be very fast. And in the longer term, the effects will increasingly depend on the extent to which the transformational action is taken to reduce emissions, avoid breaching of dangerous temperatures, and potential irreversible tipping points. So at one hand, health infrastructure, health manpower, healthcare delivery system has to work fast. We have worked very fast, at very rapid pace during pandemic, but we did not stop here. The danger is ahead, even more severe than the pandemic. And government and the society has to start these long-term projects. This can be the both ways we can avoid these problems. So health impacts will not go into the details because it will be a time consuming, but in short, I will tell. So more focus is on clean air, and for all these things, everybody of us know that it's not in only doctor's hand. That's why anybody when asked the question to me or to IMA that will the increasing number of medical colleges will give good health to the society, the answer is point blank no. Because the another most important principle of primary health care is intersectoral coordination. Though health is a very minuscule of it, or sorry, not health, but health is basically a multi-dimensional phenomenon. It's not only dependent on medical care. Medical care and health care are two different things, and we mix them to each other. Health has many dimensions. Food, water, air, shelter, all good sanitation, all these they are prerequisite for health. And doctors or medical care or hospitals cannot do anything for them. So the entire machinery responsible for all these things, they have to come into the picture. That's why we have to work in a unison with all other departments. We have to find out what are the vulnerabilities and how we can adapt this capacity to changing the meteorological conditions of our population. Forget about other population, but in India also, we have a lot of fluctuating climates. And we have seen that previously it was said that we were having 3 seasons: rainy season, then summer and winter. But nowadays you get rains anytime in the year, and this winter has shrunk and summer has extended. So this is all because of all climate changes. So health system also has to adopt this. There are various assessment methods which we can do. So we have to identify basically the weakness is the system that should protect population health as well as adoption options. The vulnerability and adoption assessments not only will improve the understanding of the linkages between climate change and health, but they can also serve as a baseline analysis against which changes in disease risk and protective measures can be monitored. They can also provide the opportunity for building capacity and can strengthen the case for investment. There are warning signs, basically, that because of these problems or because of these climatic changes, there may be increased number of cases, increased number of deaths, like morbidity, and these are very important. The core element of this climate informed early warning signs are to monitor environmental conditions. We have to keep a constant eye on these rapid changes in climate, and we have to foresee that because of these climatic changes, these diseases will come in large number, and we have to cope up with that. So health infrastructure, as a doctor, as a private practitioner also, we have to be in pace with these changing climatic factors. Forecast high risk conditions, initiate active surveillance. Surveillance is nothing but the monitoring of number of cases because of number of diseases. And if the surveillance is good, it is active surveillance, then definitely we can cope up with this increased demand due to climatic changes. Sell alerts and communication. Government will have to send the alerts and communications to the healthcare workers and establish a mechanism for early response. So these are all the things. Now, building resilience of health system and healthcare facilities, but to cope up with this increased demand on healthcare facilities. National adaptation strategies and plans. Even government also will have to see what changes they can do. They will have to train more paramedical staff, more people. They will have to come with all these treatment plans, protocols because of this increased climatic changes. And this will be apart from the preventive measures and other things which other sector can do. Monitoring and evaluation of health adoption. Repeatedly, we will have to monitor whether we are getting pace or to stop or to reduce the vulnerability to these climatic changes. Now, engagement with other sectors. We are always talking about this, that health is not the only domain of medical profession. I think this one has to make it very clear whenever somebody asks, being I am a person or being a doctor. Doctor can only treat a patient, only give medical care. But healthcare or health of the nation depends on many other factors. We come in picture only when a patient or even a person is ill. But these things or these are the preventive sectors which can definitely play a crucial role. Which are these sectors? The meteorological sector. They have to tell us what is lying in the future. How will be the climatic changes in the future? Not only for 1 day, 2 days, or 1 month or 2 months. For a year, for a decade. Water and sanitation department will have to work for good water quality and good sanitary things. Food and agriculture for organic food, not contaminated by all these pesticides and other things. Energy, even these non-conventional energy resources, one has to think of and use. And housing conditions. All this concrete and all concrete jungle is increasing. So we'll have to think about various other options than this concrete material. So these all things are not in our hand, but definitely various other departments are also engaged in this. There are many health co-benefits of climate action. It can be cost saving and improvement in health. Mitigation of climate changes in various sectors, including housing, transportation, and energy, has many co-benefits that lead to substantial health gains and reduce health risk. So what we can do? Our planet, our theme. Reimagine our economy, society, and health for healthier tomorrow. And I think the most important aspect of my talk is now. Reimagine our health for healthier tomorrow. What can we do to protect our planet and our health? Government can do. They can prioritize long-term human well-being and ecological stability in all decision making. Every decision they have to think that whether it is harming some ecosystem or not. Prioritize well-being in all businesses, organizations, social and ecological goals. Keep fossil fuel in the ground. Natural petrol or diesel, ये ground में ही रहने दीजिए. Stop new fossil fuel exploration and project and implement policies on clean energy production. And that's why we have to think about non-conventional energy resources, maybe solar energy and all other things. Tax the polluters, incentivize the carbon reduction. Government will have to think, Sama Dama Danda Bhed. So Danda is that those who are polluting, tax them, fine them, and those who are doing good work to minimize this carbon reduction, they should be incentivized or given some rewards. Implement the WHO air quality guidelines. Electrify healthcare facilities with renewable energy. Even healthcare facilities also, there should not be electricity, conventional energy. Reduce air pollution levels to reduce the burden of diseases from stroke, heart disease, lung cancer, and both chronic and acute respiratory diseases. Now, why we are having this increased burden? Because we are consuming more and more diesel and petrol. Why? Because our transport facilities are not good. Common transport facilities should be better and better, so that less and less people will use their own vehicles. Because of this non-availability of good transport facilities, we are using our own vehicles, and thereby we are consuming more and more fossil fuel. Tax highly processed foods and beverages, high in salt, sugar, and unhealthy fats. So now again, we are thinking that whatever was told by our grandfathers, grandparents, and parents was better than nowadays processed food. Implement policies to reduce food wastage. Repurpose agriculture subsidies towards sustainable and healthy food production. Build cities with green spaces that promote physical activity and mental health. Take the pledge. Adopt the WHO's Green Manifesto. Tobacco pollutes the planet and our lungs. Create smoke-free cities and tax tobacco. Devise policies on waste and plastic reduction. Integrate mental health and psychological support with climate action and policies to better prepare for and respond to the climate crisis. Work together with community leaders that include representatives of refugees and migrants on mitigation and adoption measures of climate change and support initiatives led by refugee and migrant communities at local level. Otherwise, what is happening that we leave these refugees and migrant workers, we only concentrate on the stable population. But these are the people who are more sufferers, and then they can spread the disease more fast. Many corporations or hospitals, they can also have their kharisa vata, what we say in Marathi. Everybody can put little efforts, and that will be huge when it is counted together. Switch off light so that it will reduce the transportation and fuel consumption. Remove highly processed and packaged foods from the workplace. Reduce the greenhouse gas emissions of your activities. Protect, promote, and support breastfeeding, because breastfeeding is healthy and sustainable food for the babies. Ensure safe water for the workers. Health workers and health facilities, what they can do. Support effort to reduce healthcare waste. Provide sustainably grown local food and ensure healthy food choices by reducing sodas and highly processed and packaged food in health facilities. Decarbonize health facilities. Identify opportunity to save energy. Ensure safe clean water at health facilities. Support purchase of environment-friendly products that are easily recyclable and reusable. What mayor or city can promote? Promote energy efficient buildings. Engage low carbon public transport. Build new bikes, lanes, and footpaths. Protect biodiversity and create new parks. Switch to renewable energy or non-conventional energy. Ensure low-income households and healthcare facilities have access to clean and affordable energy. Partner with local business community to support sustainability. And regulate the marketing of unhealthy foods and beverages. That is the biggest challenge we have, because our television and mass media are promoting it like anything. So the city as well as the government and we as doctors as to we can share our story, our planet, our health. What I am doing for reducing these climatic effects. Raise your voice and demand climate actions to protect your health. Take action, inspire others. And these are the 5-point plan for an individual to walk or pedal to work at least one day a week. Choose public transport. Change to renewable energy providers. Don't heat your rooms over 21.5 degrees centigrade. Turn off the light when not in room. Even for ACs also, we should always keep our air conditioners around 24 to 26 degrees centigrade only. Don't cool it more than that. Buy your fresh groceries from local products and avoid highly processed foods and beverages. Tobacco is a killer and polluter. Stop consuming tobacco. Buy less plastic. Use recyclable grocery bags. We have to take our cotton bags for getting vegetables and kirana groceries. Walk or bike, change to renewable energy providers, turn off the lights not needed, buy your groceries from local, buy less plastic, use recyclable grocery bags. Thank you very much. This was what I wanted to highlight. Though the lecture was more on a technical ground, but I think whatever we can do in last 10-15 slides, we have to concentrate on those things. I once again thank IMA Nagpur for giving me an opportunity to deliberate my views as well as whatever has been advocated by World Health Organization with all of you. Thank you. Thank you very much.
Thank you, sir, Dr. Deshpande, sir. Very well explained. As we know that today's the theme is our planet and our health. And sir has explained the key environmental determinants of health and their impacts, which includes air pollution, heat, clean water, health services, disasters, mental health, and nutrition too. Even e-waste and recently what we are seeing, like war is going on, the chemicals and all that. So sir has asked the first question to all of us, in today's world where we are living, is it safe? Can we live? Yes, definitely we can. But yes, at the same time, sir has pointed out the climate crisis is also a health crisis. So we should take care of all these things. Then sir has very well explained about the formation of new society in terms of all new protective measures to be taken to protect ourselves. As we know that air pollution is increasing, polluted water, poor sanitation. And sir has very well pointed out all these things, and he has given all the very good suggestions too. And I'm happy to that he has used the principles of primary health care. So thanks, Dr. Deshpande, sir, for enlightening us on a very, very important and vital issue. And we assure you that we will follow your 5-point plan. We'll obey your 5-point plan. Thank you very much, sir.
Thank you, Aniruddha.
Yes.
Thank you, sir.
Can I speak? Can I speak, Prajakta, for a minute?
Yes, sir. Sure.
Yeah. Am I audible?
Yes, sir.
Yes, sir. Yes, sir.
Yeah. Thank you, Sanjay, for an excellent lecture. In fact, you dwelt upon all the strategic interventions at the government level by the various departments. But while listening to the lecture, to me and all of us, the last 2 slides are very important as to what I can do to keep my health good and my planet healthy. And many of these things are doable and feasible also. Like unnecessary use of electricity, unnecessarily wastage of tap waters, we can really consciously take up these measures, avoid plastics. And I was just explaining, sharing an example. You all talk about using public transport. And now because of the metro, we can seriously think about using public transport once a week, and also use cycling. I'll just give an example of cycling. The other day I went to Seminary Hills, and when you go to Seminary Hills in the morning, you will find at least 50 to 100 cars. All young boys come there for walking. They keep their cycle in the car, get down at Seminary Hill, and then go on cycling. And then when I interviewed few young chaps, they were coming to Seminary Hills from 10 kilometers or more than 10 kilometers distance using their car and then going on walking or using cycle in Seminary Hills. So is it a fashion or is it a symbol of sort of elite class of boys, girls and population going for walking in Seminary Hills? Can they not do it around their home and stop using car for 10 kilometers and 20 kilometers per day? It will make a difference. So this is, one has to think it seriously. Another issue I was thinking, what IMA can contribute to. Especially you talked about highly processed food, junk food causing obesity and lot of diseases in adolescents and later on. You must be aware about one organization in Nagpur, Ashadip Sanstha. This Ashadip Sanstha is headed by Dr. Pratima Shastri. She is retired professor and head of the nutrition department of Lakshminarayan Institute of Technology. And this Sanstha has come out with low cost lot of food supplements, especially the flour made up out of combination of lot of pulses, lot of cereals, which really add nutritional value. These products have been recognized and approved by the Food and Drugs Administration Department. So I am planning to, and they are very low cost at the same time, very cheap as compared to the same product available in the market with beautiful packings. So I am planning to have a stall in IMA house during the office hours daily throughout the year, so that this low cost and excellent quality with nutritious value of all the flours, wheat flour combined with bajra, combined with jari, combined with ragi and something like that, they will be available to all the medical professionals in IMA. So I'll request you, could we from 1st May, we'll have this stall available. So I will request all the doctors to make use of these products. So this will be one sort of intervention from IMA to ensure supply of good quality of foodstuffs, good quality of flour. And I'll also request Dr. Pratima Shastri, and we'll go and coordinate with her so that all these products are regularly available to IMA for sale. Thank you very much, Sanjay.
Yes, sir. Actually, what you suggested that आपण लहानपणी मिसळीची भाकरी पण खायचो आणि मिसळीचं वरण पण खायचो. And our forefathers and our ancestors were very wise enough to know that which food should be consumed in which season. There are a lot of changes in our food habits when the season changes. Unfortunately, because of the all mass media, all the westernization, we have forgotten those things. So it is now time to start eating the things and doing the things what our parents or grandparents were doing. And as rightly told by Dr. Dev, that if we start going by public transport at least once a day in a week, one day in a week, if everybody does that, I think we can reduce this climate issues to a considerable level. आपण आपला खारीचा वाटा घ्यायलाच हवा. Thank you.
Thank you so much, sir. Our chairpersons, I think there are no questions in the chat box. So I think we all agree. Sir? Yes, please.
Sir, we were discussing the effect of climate change on our environment and health. Could you please highlight a little about the radiation effects of radiation, mobile radiation towers, 5G, 4G network, and our young generation actually falling prey to the addiction of WhatsApp and whatnot. So how can we go about having the less impact on our environment because of this?
That's why actually there was one point in that total lecture also. It was on smartphone only. So smartphone radiations and all, there are many studies going on, but we are not substantially have any proof that it causes so and so diseases. But definitely there must be some effect on us in our body. So that's why one day holiday for smartphone or one day holidays for your WhatsApp or your mass media or social media activity, that also can work well.
Thank you, sir.
Thank you. So may I proceed?
Yes, sure.
Is there any query? Sushma madam, Devke sir?
If there are any questions from the audience that
Any
No,
questions?
I'm not able to.
प्रश्न नहीं है कारण कि actually this topic is for introspection.
Yes, so we all agree to agree. We never.
Everybody is introspecting. Even I am also, when I started preparing for this topic, I also started introspecting myself that how I am contributing to these all problems of the society. So if I start reducing this contribution, which will add to this pollution, I think I have done my job.
Yes, so we never value our health until we lose it, but we don't let that happen and take care of our own wellness, because he who has health has hope, and he who has hope has everything. So thank you, Deshpande sir, and I request our chairpersons to felicitate our speaker by e-momentum.
Thank you.
So we can just
kindly
unmute.
accept our e-momentum.
Yes, we can unmute ourselves, all panelists, and
Yes. So congratulations, Sanjay, for excellent presentation.
Thank you.
then I request our President Dr. Dev sir and Secretary Dr. Samir to felicitate our chairpersons. Dr. Dev K.
Thank you.
Please accept the e-memento.
Yes, ma'am. Thank you very much. Thank you.
And Dr. Sushma Thakre, madam.
Excuse me, I can't.
Thank you.
hear
Thank you,
anybody.
sir.
Hello.
Hello. Yes, Dr. Samir.
Hello.
Yes,
There is some-
Samir, we can hear you.
Hello.
हाँ बोला ना सर आवाज येतो है.
Hello. Hello.
You are audible. You are audible.
Hello.
Audible, audible.
You're audible. So shall I welcome Dr. Samir Jagirdar, Secretary IMA Nagpur, for vote of thanks, formal vote of thanks. I think there is some network issue.
Am I audible? I can't
Yes.
hear anyone.
Yes.
Yes, you are audible.
Okay. So shall I proceed?
Yes, sure.
Yeah, thank you. It's a privilege for me to express a vote of thanks for this all-important program, which was conducted on World Health Day. That is a CME on our planet and our health. For this CME, we had very eminent speaker in Dr. Sanjay Deshpande sir, who is also a past president of IMA Nagpur. Thank you, sir, for enlightening and highlighting all the points which actually cause changes in climate and how can we go about for reducing the climate change and adverse effect on health. So thank you, Deshpande sir, for your valuable time. We had very important and very eminent doctors from Public Health Department as chairperson for this CME. Dr. Sushma Thakre, who is also Secretary of IMA MS, and Dr. Aniruddha Devke sir, who is Honorary Treasurer of IMA Nagpur. So thank you, chairpersons, for all valuable inputs, comments, and your ideas regarding climate change and the way we can stop the climate change and adverse effect on health. I also take this opportunity to thank the convener of this program, though she is not here because of her prior engagements, Dr. Ragini Mandlik, who is Secretary of IMA MS, and she has taken a lot of efforts to actually organize this program. So thank you, Ragini Madam, for your valuable time. I also thank our MOC, Dr. Prajakta Karuskar, who is Joint Secretary of IMA Nagpur, for conducting this program so efficiently. May I request to present a memento, e-memento to our MOC, Dr. Prajakta Karuskar.
Thank you. Is it visible?
So,
Thank you.
as in fact suggested by our MOC herself, let us clap on the screen for this memento presentation. Thank you. And last but not least, let me thank the attendees who took all valuable time to attend and listen to this very important topic of climate change and adverse effect on health. So thank you to all delegates also, and also I must extend my thanks to DigiShield for providing digital platform for this program. So thank you very much. Over to you, Dr. Prajakta.
So any special comment, concluding comments from our President Dev sir? Can we conclude the program? Dr. Samir, you can tell whether we can conclude the program. Yes, sir. Devke sir, please.
Yeah, ma'am, for Deshpande sir, I would like to request one more thing, because you know that for today's life, the e-waste topic is very important. I mean, as we are using all these different gadgets, we are doing this CME, then you are using all smartphone and all that. So in future or coming year, this year, because we are implementing all this, all preventive measures in coming year as a theme of WHO. So my request will be there, like all the public health consultant, can we have concentrate on this e-waste matter for the discussion? Thank you.
Thank you, sir.
Definitely, but I'm just when you were discussing this thing, I just thought that had this CME in IMA's hall,
sir,
at least 35 to 40 people, which now we are listening to each other, would have to drive from their places to IMA.
Right.
We have consumed a lot of fuel and we have contributed.
So it's compensatory.
Yes.
And of course, there may be some problems by using all these gadgets. As rightly said by one of the, I don't know the writer or who spoke this, that take what you want and pay for it later. So we don't know what will be the hazards of using this sort of online CMEs or online deliberations. Nowadays, people are, even our patients wants to have the online treatments and everything. But because even when we were having this lockdown, previously we would not see these sparrows. चिमण्या दिसायच्याच नाही आधी. आणि नंतर लॉकडाऊन लागल्यानंतर वातावरण इतकं छान झालं होतं, क्लायमेट सुधारलं होतं, pollution, air qualities was improved, everything was improved. So maybe they may have some change, some effects, but definitely will not be that much as we are rightly facing because of all these petrochemicals and other things.
Thank you, sir. Thank you.
Right.
Thank you.
Thank you. With permission of Dr. Prakash Dev sir and Samir Jagidar, I would like to conclude the program. Thank you all the delegates and all the panelists.
Thank you. I am in Nagpur.
Thank you.
Thank you, sir. Thank you.